8-year-old male child came to the OPD with complaints of recurrent episodes of photophobia, redness, itching, watering, blurring of vision and blepharospasm in both eyes since few years. On examination, patient had bilateral refractory papillae and shield ulcers in both eyes. Patient was on long-term topical steroids and topical immunomodulators for almost more than 6 months. Patient also received supratarsal injection of triamcinolone in upper tarsal papillae. Still, symptoms were not relieved. What to do next? We planned buccal mucosal grafting in this child. Under general anesthesia with nasal intubation, we marked the area slightly larger than conjunctival raw bed on lower lip mucosa. Marked area dissected using 15 number blade. The bleeding vessels cauterized. The edges of the raw lip mucosa were approximated using 5-0 Vicryl suture. Then the harvested graft thinned out by excising submucosal fat and fibrovascular tissue. Oral mucosa is known to be slightly non-responsive to allergic stimuli. Hence, we decided to take oral mucosal graft. Then 4-0 silk suture passed through upper lid. Subconjunctival incision was taken without damaging tarsal plate 1 to 2 mm from the edge of the papillae. Tarsal conjunctiva along with giant papillae was excised with 15 number blade. Mucosal membrane graft was sutured to conjunctival edge with 8-0 Vicryl. Rest area is covered by amniotic membrane graft and sutured with 8-0 Vicryl. BCL applied to the eye and eye closed. Post-operative medications, topical antibiotics, topical steroids in tapering dose and topical lubricants were added. In early and late post-operative period, no recurrence of giant papillae or shield ulcers was observed in any eye. Here we can see the post-operative picture of the patient with smiling face. Thank you.
Yeah, it is a nice technique actually, but it is done by your senior, Dr. Suchi, I think. Yeah.
Consultant.
Okay.
So in later phase there is some irritation, persisted long itching irritation, persisted
No
for
sir.
long.
Patient is 1 year post-op now and no recurrence is there.
So what is the mechanism that works, because you've used both buccal mucosa and amniotic graft. So what is doing what?
Traditionally we use buccal amniotic graft or mucosal membrane graft. We here tried buccal mucosal graft additionally because it is slightly non-responsive to allergies. So
It's not responsive to allergy. So you
Yeah.
see that it's better immunoprotective.
yeah,
You're doing that, and because the area is larger, so then you also have
Ha,
to put the
had to
amniotic
cover
graft.
with
so
amniotic
a smaller
membrane graft.
portion of buccal mucosa,
Yeah.
and then a larger
Amniotic
and
membrane
then you
graft.
kept him on immunomodulator
For
one
6
eye or
months.
both the eyes,
Both eyes.
and they do well
Yeah.
in extreme cases.
Yes. Yes.